Hey guys, my name is Evan, registered nurse actually. Going to talk about a couple of different things, differences between a registered nurse and an advanced practice registered nurse. Going to talk about 6 subjects here: daily task, work environment, education, salary, regional outlook, and just a little comparison between the two at the very end. So we'll dive into daily tasks first. When we look at daily tasks as far as a registered nurse versus an APRN, really, daily tasks for registered nurses include full head-to-toe assessments. It's one of the key things that all registered nurses will do depending on where they work, but more than likely they're still going to have to be able to do it. Especially if you're taking care of patients in general, you're going to be doing head-to-toe assessments. It's key to taking care of your patients adequately. Next is just medications that we will pass, getting the medications in them that they need to try to get them better. Some other daily tasks that we do is, just talking with doctors, talking with nurse practitioners, talking with dietary, talking with education, talking with, infectious disease, just different other occupations that are all involved in the care of the patients, specifically at the hospital for sure. As far as advanced nurse practitioners go, we look at a different side of this. Advanced nurse practitioners are still going to be doing assessments, especially if they're in the hospital. They rely on us a lot as bedside nurses, but they'll come through and they'll take a look at the patient. They may not do as full head-to-toe assessments as we do, but they're still getting the general idea of what's going on. They get their assessment a lot from just asking questions, writing their history and physical, documenting that. Next, whereas registered nurses pass medications, we don't see APRNs do that. We see them prescribing the medication. So once you have that degree, you're allowed to, put in orders, prescribe medications, and all these come through a doctor first. We can't, as an APRN, we're not able to prescribe our own medications without a doctor's approval first. But at that point in your life, and when you're an APRN, you have that scope of practice. Another thing that we see is APRNs, depending on where you're working, FNPs, they do different procedures in clinics and stuff, but as in like an acute care nurse practitioner, especially working in like ICU, we deal with a lot of procedures in the unit. And some of those procedures can be, thoracentesis or intubations or central line placements. As an APRN, at that point in your life, you're able to do these things. It's within your scope of practice as long as you have got the right certifications and gone through the right classes and passed those classes. It's great, we're not allowed to do that as registered nurses, but we can as APRN. So, if that seems interesting to you, you can always pursue that degree. Next, we'll go over work environment. Work environments for registered nurses include, hospitals, nursing homes, offices, PA offices. We can even do telehealth, just asking some questions in general. We have a wide variety of places that registered nurses can work in. A lot of them include one-to-one for patients, But there are some options where you don't have to see your patients. You can just ask questions and stuff. Majority of registered nurses will be one-to-one with patients, I guess being more involved in patient care. As far as APRNs go, that just depends on what you specialize in. You're still going to be taking care of patients. More than likely, you're not going to be at the bedside 12 hours of the day for sure. But, if you're in a clinic, you're going to be in an office dealing with patients all the time, every day. You're going to have 30 to 40 people come through your office in an 8-hour day. It's not bedside, but you're going to be dealing with patients one-to-one. If you're in hospital settings, you make your rounds in the mornings, specifically like acute care nurse practitioners. They'll make their rounds in the mornings, do some charting, make adjustments to some orders, see what we need to do for the day. And, they may make their rounds again later that afternoon, see how they're doing, see how, 6-7 hours later, if they're doing any better. That's key differences between registered nurses, work environment versus APRNs. Thirdly, we'll go over education. Registered nurses can either be an ADN, which is an associate's degree, or a BSN. Typically, ADN is anywhere from 2 to 3 years, depending on how fast you want to go. BSN usually takes 4 to 5 years. Unless you're on like a fast track program, which there are some out there, we won't cover that. But mainly, BSN is a 4 to 5 year degree. It is a bachelor's degree, and you have to go through all your gen ed classes just like anybody else, and then you have prereqs on top of that. And then once you're accepted into a nursing program, you usually have typically 2 to 2.5 years of your nursing degree to finish. Once you graduate, you have your BSN RN degree. Schooling's not easy. They don't make it easy. It shouldn't be easy. If you're taking care of patients and you're going to be, taking care of a patient's life, then you need to know what you're doing. So, when we look at APRNs, you can't just get your APRN right after college. You have to work as a registered nurse for so many years. Depending on anything that you go into, you got to have so many hours of experience before you can go back to school, which is a good thing. And so APRNs, we look at, usually 2 years, depending on what you decide to go into as an APRN. You've got different ones. You got FNP, you've got acute care, MP, you've got interventional cardiology, MP, you've got CRNA. All these require at least 2 years. Some of them require 3. Most of your CRNA programs offer courses that can get you out in 2.5 years, but most of them are 3 years, and it's full time. So when we look at nurse practitioner side of things, anything to deal with FNP, acute care MP, cardiology MP, that's typically going to be 2 to 2.5 years. Good thing about MP is that you can work part-time, full-time at your job site, and you can take classes part-time or full-time, depending on how quick you want to get through the program. If you're not in any rush, part-time's great. And it's a little bit more lenient. There's some programs that offer it online, and that then once you get out after your first year and a half of schooling through MP, a lot of it's typically just clinical sites that you have to attend and get so many hours underneath certain professions. Looking at CRNA, CRNA is a little bit different. A lot of times they don't allow you to work during that time while you're going to school. It also is usually 3 years. I don't see a lot of 2.5, but usually it's 3 years. It's generally a little bit harder. You're dealing with a lot more things. You have a lot of autonomy once you're out of CRNA school, but the more education you get, usually the more money you can make. But that is kind of the whole aspect of education. Salary for registered nurses in Kentucky, we're looking at about $65,000 is a mean salary, which is average salary for most Kentucky registered nurses. These changes in every state, we're on the higher side of mean salary for registered nurses, but if you go to like California, you're looking at like $102,000 for your mean salary. The reason why is there's a lot of different things involving with like taxes and affordability out there, but we won't dive into that. Salaries for acute care nurse practitioners, FNPs, CRNAs, they all differ a little differently, but just your average nurse practitioner makes anywhere from $102,000 to $110,000 a year in Kentucky. CRNAs usually typically bring in about $160,000 a year. So yes, salary is a lot better when you get more education, but sometimes it's not necessarily what it's all about, and a lot of people don't want to go back 2 to 3 years for the education just for an extra $40,000, $50,000, $60,000, and that's all up to you. It is personal preference. Our regional outlook for registered nurses in Kentucky, it's a little bit lower than I thought it would be, but through 2021 to 2031, we're looking at about a 6% increase in registered nurses. With COVID and how many people left the bedside, I would have thought that number would have been a little bit higher, but 6% is still above average for all occupations. And the good thing about being a registered nurse is there's great job security. You know, there's a lot of flexibility in our jobs, a lot of places that we can go work. It just depends on where you want to work necessarily. As far as nurse practitioner, nurse midwives, and nurse anesthetists, that was way higher than I thought. You know, a lot of times I've been hearing it's, you know, saturated, but they're looking at about 40% increase in jobs in the next 10 years. From 2021 to 2031, we're looking at 40% increase. That is very significant. That is double, triple what just the average occupation is. So, you know, there's benefits to going back to school, getting these certain degrees, because that's even more of a job security that you have. And like I said, that's all personal preference once again, but the good thing about these jobs is with the increase in demand, you for sure know you have a job. And then finally, comparison between registered nurse versus an advanced practice nurse. It's all personal preference at the end. You know, you go through school to be a registered nurse. A lot of times people will say they never want to go back to school. But you know, that just depends on what you want to do. There's good things and bad things about registered nurses. There's good things and bad things about higher education degrees. In my opinion, it's great to be a registered nurse. You get to see a lot, you get to do a lot. I feel like before you make that transition to go back to school, get as many hours as possible in at the bedside, learn while we do these things, when we kind of do these things. And, you know, once you're ready to make that next step, go for it. Just try to be the best registered nurse you can be, because if you ain't the best registered nurse you can be, you're not going to be a good advanced practice nurse. And that means a lot because you have more liability, more responsibility when you go back to school to do these things, as far as prescribing meds, ordering meds, procedures. But yeah, that is the difference in comparison, I guess, of registered nurses versus APRNs. Both of them are great jobs. You got job security in both. You have a lot of autonomy in both degrees. At the end of the day, you have to be a registered nurse with a bachelor's in science to get to any type of APRN degree. So that is my spiel on registered nurses versus APRNs. I appreciate it. Thank you for your time.